Did you know that the medication sitting in your nightstand right now could be quietly affecting your memory in ways that perfectly mimic early dementia? You take it thinking you're solving one problem, completely unaware that it might be creating another. Right now, millions of seniors are experiencing memory fog, word-finding difficulties, and confusion, and they're blaming age when the real culprit could be hiding in plain sight. A groundbreaking 2019 study published in JAMA Internal Medicine tracked over 3,000 adults for 7 years and discovered something that should concern every person over 65. Those with the highest exposure to certain common medications had a 54% increased risk of developing dementia. That's more than half again the normal risk. And here's what's truly alarming. Most of these seniors had no idea their medications could affect their brain. But there's something even more disturbing. These aren't rare, exotic drugs. They're medications sitting in medicine cabinets across America right now. Pills for sleep, allergies, heartburn, and anxiety that millions take daily, trusting they're safe because they're common. I'm Dr. Stephen Whitman, and today on The Seniors Thrive, we're going to reveal 9 categories of medications that peer-reviewed research shows may be stealing your cognitive sharpness, ranked from concerning to potentially devastating. Before we dive in, let me know in the comments what medications you're currently taking, and whether you've noticed any changes in memory or thinking since starting them. Your experience could help other viewers recognize patterns they've missed, and I want to be crystal clear. Every medication we'll discuss serves legitimate medical purposes. The goal isn't to frighten you away from necessary treatments, but to arm you with knowledge so you can have informed discussions with your healthcare team about optimizing your regimen for both physical and cognitive health. Let me know in the comments what medications you're currently taking, and whether you've noticed any changes in memory or thinking since starting them. Understanding your experience helps me create content that addresses your real concerns. Now let's examine what the research tells us, starting with number 9. Number 9. First-generation antihistamines diphenhydramine, commonly known as Benadryl, sits in virtually every American medicine cabinet. It's inexpensive, available over the counter, and many people consider it harmless. However, diphenhydramine belongs to a class of medications called anticholinergics, which work by blocking acetylcholine, a neurotransmitter crucial for memory formation and cognitive function. A 2019 study published in JAMA Internal Medicine followed over 3,000 adults aged 65 and older for 7 years. Researchers found that participants with the highest cumulative exposure to anticholinergic medications, including diphenhydramine, had a 54% increased risk of developing dementia compared to those with minimal exposure. The risk appeared to be dose-dependent, meaning higher cumulative exposure correlated with greater risk. The concern becomes particularly relevant for older adults because aging brains produce less acetylcholine naturally. When medications further reduce this neurotransmitter's activity, the cumulative effect can impair memory formation and recall. Additionally, older adults metabolize diphenhydramine more slowly, leading to prolonged effects and potential accumulation. If you're using diphenhydramine for allergies, newer antihistamines like loratadine or cetirizine don't cross the blood-brain barrier as readily and may be safer long-term options. For sleep, addressing underlying sleep hygiene issues or consulting with your doctor about alternative approaches may be more beneficial than relying on sedating antihistamines. Number 8. Proton pump inhibitors. Proton pump inhibitors, or PPIs, including medications like omeprazole and esomeprazole, are among the most commonly prescribed drugs for acid reflux and stomach ulcers. A comprehensive 2016 study published in JAMA Neurology examined data from over 73,000 participants aged 75 and older. The research found that regular PPI users had a 44% increased risk of developing dementia compared to non-users. The proposed mechanisms involve several pathways. PPIs significantly reduce stomach acid production, which can impair the absorption of vitamin B12, a nutrient essential for neurological function. PPIs also affect the absorption of magnesium and calcium, minerals important for nerve function and brain health. If you've been taking PPIs long-term, discuss with your doctor whether you still need them, or whether alternative approaches might work. H2. Receptor blockers like famotidine may provide adequate acid suppression for some people with potentially fewer cognitive concerns, though they're not risk-free either. Number 7. Bladder control medications. Oxybutynin and similar medications prescribed for overactive bladder work by blocking acetylcholine receptors, making them particularly potent anticholinergics. Unlike some medications that have difficulty crossing the blood-brain barrier, oxybutynin readily enters brain tissue, where it can interfere with cognitive processes. A 2019 study in BMJ followed nearly 300,000 adults aged 65 and older for 11 years. Participants using strong anticholinergic medications like oxybutynin for bladder control had a 49% increased risk of developing dementia. The risk was highest among those who used these medications continuously for more than 3 years. What makes this particularly concerning is that bladder control issues often worsen with age, leading to long-term medication use. Fortunately, newer bladder control medications work through different mechanisms. Mirabegron, for example, relaxes bladder muscles without blocking acetylcholine and appears to have minimal cognitive effects. Behavioral interventions, pelvic floor exercises, and bladder training can also be effective for many people. Number 6. Cholesterol-lowering statins. Statins represent one of the most complex topics in geriatric pharmacology because they prevent heart attacks and strokes, while potentially affecting cognitive function in some individuals. The relationship isn't straightforward, and the research presents mixed findings. Some observational studies have suggested associations between statin use and cognitive changes. A 2020 review in Frontiers in Aging Neuroscience analyzed multiple studies and found that while most participants experienced no cognitive effects, a subset of users reported memory problems, word-finding difficulties, or mental cloudiness. These effects appeared to be more common with lipophilic statins that readily cross the blood-brain barrier. The proposed mechanism involves cholesterol's role in brain function. The brain contains about 25% of the body's cholesterol, which is essential for maintaining cell membrane structure and producing neurotransmitters. However, it's crucial to understand that statins prevent cardiovascular events that can themselves cause dementia. Preventing these events may actually protect cognitive function in the long term. The key is individualized care. If you're experiencing cognitive changes while taking statins, discuss this with your healthcare provider. They might consider switching to a hydrophilic statin that doesn't cross the blood-brain barrier as easily, adjusting the dose, or weighing your cardiovascular risk against potential cognitive concerns. Number 5. Anti-anxiety medications. Benzodiazepines. Benzodiazepines, including lorazepam, diazepam, and alprazolam, are highly effective for managing anxiety and panic disorders. Benzodiazepines work by enhancing GABA, the brain's primary inhibitory neurotransmitter. While this reduces anxiety, it also slows overall brain activity. A landmark 2014 study published in BMJ followed over 1,000 participants for 15 years and found that benzodiazepine use was associated with a 43 to 51% increased risk of developing dementia. Older adults face particular risks because they metabolize benzodiazepines more slowly, leading to accumulation and prolonged effects. The sedating properties can increase fall risk, and cognitive impairment may compound age-related changes in thinking and memory. The withdrawal process requires careful medical supervision because stopping benzodiazepines abruptly can be dangerous. Alternative treatments for anxiety include buspirone, which doesn't carry the same cognitive risks, selective serotonin reuptake inhibitors, and non-pharmacological approaches like cognitive behavioral therapy. If you're taking benzodiazepines, talk to your provider about a supervised taper and alternative strategies. Number 4. Tricyclic antidepressants. Amitriptyline and other tricyclic antidepressants were among the first effective treatments for depression, and they're still prescribed today for depression, chronic pain, and sleep disorders. Amitriptyline and other tricyclic antidepressants were among the first effective treatments for depression, and they're still prescribed today for depression, chronic pain, and sleep disorders. However, their strong anticholinergic properties make them particularly concerning for older adults. The same 2019 JAMA Internal Medicine study I mentioned earlier found that tricyclic antidepressants were among the medications most strongly associated with dementia risk. The cognitive effects can include difficulty concentrating, memory problems, confusion, and slowed thinking. Additionally, tricyclics can cause sedation, dizziness, and orthostatic hypotension, increasing fall risk. The combination of cognitive impairment and physical side effects can significantly impact quality of life and safety in older adults. Modern antidepressants like sertraline or escitalopram generally have fewer anticholinergic effects and may be better tolerated by older adults. For chronic pain, alternatives might include duloxetine, gabapentin, or topical treatments depending on the specific condition being treated. Discuss risks and benefits with your provider and consider alternatives when appropriate. Number 3. Certain SSRI antidepressants. While selective serotonin reuptake inhibitors are generally considered safer for older adults than tricyclic antidepressants, paroxetine stands out as an exception. Unlike other SSRIs, paroxetine has significant anticholinergic activity, making it potentially problematic for cognitive function in older adults. Research published in the International Journal of Geriatric Psychiatry found that older adults taking paroxetine showed greater declines in cognitive testing scores compared to those taking other antidepressants. The irony is that depression itself increases dementia risk, making effective treatment crucial. However, choosing the right antidepressant matters. Other SSRIs like sertraline, escitalopram, or citalopram have minimal anticholinergic activity and may be better choices for older adults who need antidepressant treatment. Depression in older adults often goes unrecognized and untreated. Partly due to stigma and the misconception that sadness is a normal part of aging. Effective treatment of depression may actually protect against cognitive decline, but the choice of medication should consider both efficacy and cognitive safety. Number 2. Antipsychotic medications. Perhaps the most concerning category involves antipsychotic medications like quetiapine, risperidone, and olanzapine. While developed for serious psychiatric conditions like schizophrenia and bipolar disorder, these drugs are frequently prescribed off-label to older adults for sleep problems, agitation, or behavioral symptoms. A 2022 comprehensive review in the Lancet Healthy Longevity examined data from over 25,000 older adults and found that those prescribed antipsychotics for behavioral symptoms were 71% more likely to experience accelerated cognitive decline within 1 year. Antipsychotics work by blocking dopamine receptors in the brain. While this can reduce agitation and psychotic symptoms, it also affects areas responsible for movement, motivation, and cognitive function. The result can be a syndrome resembling advanced dementia, with severe cognitive impairment, emotional blunting, and physical deterioration. The tragedy is that many behavioral symptoms in older adults have underlying causes that can be addressed without antipsychotics. Pain, constipation, urinary tract infections, medication side effects, or environmental factors often contribute to agitation. Addressing these root causes, along with behavioral interventions, can often manage symptoms more safely. When antipsychotics are necessary, they should be used at the lowest effective dose for the shortest possible time, with regular reassessment of their continued need. The most dangerous situation isn't necessarily any single medication, but the cumulative effect of taking multiple drugs with anticholinergic properties simultaneously. This phenomenon, called anticholinergic burden, may be the most under-recognized cause of reversible cognitive impairment in older adults. Consider this common scenario. An older adult takes diphenhydramine for allergies, oxybutynin for bladder control, and amitriptyline for sleep. Individually, each might cause mild cognitive effects. Together, they create a compounding burden that can severely impair mental function. A 2019 study published in Age and Aging followed nearly 14,000 older adults and found that those with the highest anticholinergic burden scores had more than double the risk of developing dementia over 10 years. The researchers developed scales that quantify the anticholinergic activity of various medications, allowing clinicians to calculate a patient's total burden. What's particularly hopeful about anticholinergic burden is that it's often reversible. When problematic medications are discontinued or replaced with alternatives, many patients experience significant improvements in memory, alertness, and overall cognitive function within weeks to months. Healthcare providers can use anticholinergic burden calculators to assess a patient's total risk and identify opportunities for optimization. This might involve discontinuing unnecessary medications, switching to alternatives with lower anticholinergic activity, or reducing doses when possible. It's also important to address underlying conditions that might allow medication reduction. Improving sleep hygiene might reduce the need for sleep aids. When problematic medications are adjusted, many patients regain clarity and function. The relationship between medications and cognitive function in older adults is complex, and individual responses vary significantly. Some people tolerate these medications well, while others experience notable cognitive effects. Cardiovascular disease, diabetes, social isolation, physical inactivity, and hearing loss all contribute to cognitive decline. Sometimes medications that slightly increase cognitive risks may provide overall benefits by treating conditions that would otherwise harm brain health. If you recognize medications you're taking on today's list, don't panic or stop them abruptly. Instead, schedule a comprehensive medication review with your healthcare provider. Bring a complete list of all prescription medications, over-the-counter drugs, and supplements you take regularly. Discuss any cognitive changes you've noticed, even if they seem minor. Keep a simple log of memory concerns, mood changes, or thinking difficulties to share with your medical team. This information can help guide decisions about medication adjustments. Questions to discuss with your healthcare team include: is this medication still necessary for my current health status? Are there alternatives with fewer cognitive risks? What would happen if we reduced the dose or discontinued it gradually? How can we monitor for both benefits and side effects? Regular medication reviews with healthcare providers are essential, especially when cognitive changes occur. This process, sometimes called deprescribing, involves systematically evaluating each medication's continued necessity, effectiveness, and risk-benefit balance. It's also important to address underlying conditions that might allow medication reduction. Improving sleep hygiene might reduce the need for sleep aids. Lifestyle modifications could help manage anxiety or depression. Physical therapy and exercise might reduce reliance on pain medications. Hearing loss can contribute to cognitive decline. Addressing it can improve communication and reduce misattributed cognitive concerns. For example, well-controlled blood pressure using appropriate medications generally protects against cognitive decline, even if some blood pressure medications have mild cognitive effects. The key is finding the right balance for each individual. If you recognize medications you're taking on today's list, don't panic or stop them abruptly. Instead, schedule a comprehensive medication review with your healthcare provider. Bring a complete list of all prescription medications, over-the-counter drugs, and supplements you take regularly. Discuss any cognitive changes you've noticed, even if they seem minor. Keep a simple log of memory concerns, mood changes, or thinking difficulties to share with your medical team. This information can help guide decisions about medication adjustments. Remember that cognitive changes in older adults can have many causes. Medication effects, when they occur, are often reversible. I'd love to hear about your experiences in the comments. Have you noticed cognitive changes with any medications? Have you successfully worked with your healthcare team to optimize your medication regimen? What questions do you have about balancing medication benefits and risks? Your experiences help me understand what topics matter most to our Seniors Thrive community. If you found this information helpful, please share it with family members or friends who might benefit from this discussion. Subscribe to the Seniors Thrive for more evidence-based information about healthy aging. And remember, the goal isn't to avoid all medications, but to use them wisely in partnership with knowledgeable healthcare providers who understand the unique needs of older adults. Until next time, here's to thriving at every age through informed healthcare decisions. I'd love to hear about your experiences in the comments. Have you noticed cognitive changes with any medications? Have you successfully worked with your healthcare team to optimize your medication regimen? What questions do you have about balancing medication benefits and risks? Your experiences help me understand what topics matter most to our Seniors Thrive community. If you found this information helpful, please share it with family members or friends who might benefit from this discussion. Subscribe to the Seniors Thrive for more evidence-based information about healthy aging. And remember, the goal isn't to avoid all medications, but to use them wisely in partnership with knowledgeable healthcare providers who understand the unique needs of older adults. If you recognize medications you're taking on today's list, don't panic or stop them abruptly. Instead, schedule a comprehensive medication review with your healthcare provider. Bring a complete list of all prescription medications, over-the-counter drugs, and supplements you take regularly. Discuss any cognitive changes you've noticed, even if they seem minor. Until next time, here's to thriving at every age through informed healthcare decisions. Subscribe to the Seniors Thrive for more evidence-based information about healthy aging. And remember, the goal isn't to avoid all medications, but to use them wisely in partnership with knowledgeable healthcare providers who understand the unique needs of older adults.